Today, I'd like to talk to you about some of the assessment of preoperative requirements and outcomes after presbyopic cataract surgery. And in particular, I want to share with you some work that's been done with Simvision and Gekko by Two Eyes Vision. This is a system that was developed by Susana Marcos and her group in Madrid. Very exciting system, which allows visual simulation. And it looks like a virtual reality system, as you can see here on the upper right, but it's not virtual reality. You're actually simulating different things that we see at distance and near under different lighting conditions as well in a very systematic way. The beauty of this is it's non-invasive and allows pre-IOL patients to actually simulate multifocality. In addition, it identifies if someone is a suitable candidate for a multifocal. It allows them to literally take the multifocal that you're testing out for a test drive under different lighting conditions. And you can also do the same thing with contact lenses. So the contact lens industry is also very interested in this for multifocal contact lenses as a way of pre-screening patients to see if they'd be successful contact lens wearers with a multifocal. The treatments can be personalized. So you can literally, when you put this on, you can actually do a extended depth of focus optic like a symphony in one eye, and a simulation of a other multifocal trifocal lens, Optometrica, or a number of different trifocal lenses as a choice. And you can actually simulate those, as I'll show you in just a bit. And it's a binocular system. So, well, how do they actually do this? SimVis works by using an optotunable lens. It's a custom high-speed electronic driver. And it does temporal multiplexing, which uses periodic variation of optical power at 50 hertz. This creates a static appearing multifocal image for the patient. And that's actually simulated over on your left here, where the lens is actually changing and alternating at 50 hertz. So, well, how did they actually set this up? The SimVis pattern was actually taken from defocus curves and actually simulates those defocus curves for different lenses. So you can take a multifocal IOL, put it on an optical bench, create a defocus curve for that, and then emulate that with the SimVis system. So when we do that on an optical bench, or when Susanna's group did that, they found that there was really excellent correspondence and very high correlation with the actual lens on the optical bench. The clinical value of this solves with some of the problems that we have. It's very hard for us to explain multifocal vision to patients. We can describe it, but we can't demonstrate it. This system can actually demonstrate the multifocal vision to patients under varying conditions. It's also difficult to manage their expectations, but by using this system, you can actually give them a reasonable idea of what it would be like to look at distance vision under photopic or mesoptic conditions, as well as near vision under photopic and mesoptic conditions. This allows you to manage their expectations. The other problem that we have, the other barrier, is that it's very uncertain. We don't know which patients are going to be doing well with this system and which patients are not going to be doing well. And so this allows you to actually simulate this for the patients so that you get a really reasonable idea as to whether they'd be a successful candidate or whether they are not going to adjust to this at all. There's currently no commonly used screening tool, so this fits a need for that. Patients are currently not offered multifocal lenses as frequently as they could be if we had a way to actually describe to them visually what they would experience with a multifocal. And they can't try the lens on before implantation. The beauty of this is it allows a patient to take the multifocal lens, and you can test varying different types of multifocal lenses You can take them for a test drive, let them simulate it under a variety of conditions, as I'll show you in a few minutes. The clinical and commercial value of SimVis allows us as clinicians to sell more premium IOLs if it's appropriate for those patients. But just as importantly, and I really like this, it allows us to screen out prospective unhappy patients. One of the biggest barriers, I think, to multifocal lens, the multifocal lens strategy is that we can't determine what that 3, maybe 5% of patients that aren't quite happy with their multifocal width. It's very difficult to screen that out. And for patients that, let's say, have a subtle irregular astigmatism, this will allow you to literally screen that out by simulating it for the patient. When they notice that they can't see well with it, then they would probably defer from having a multifocal. This allows better patient satisfaction because you're both speaking a more common language in terms of the multifocal demonstration. It allows to compare across different intraocular multifocal lens solutions. And it also saves time because you have a way of actually demonstrating this to the patient in terms of their multifocality. And from a business standpoint, it saves money in terms of chair time. It also offers a competitive advantage in the sense that practices that are using this are perceived as being very advanced in terms of using technology to actually articulate this to the patient. And also, it increases the multifocal presbyopic commercial availability in the sense that it makes it more accessible for them to understand the effect of a multifocal. So, well, how does this actually work? Well, the binocular visual simulator is a wearable device. It's binocular. You see through it. So you can actually walk around a room. And I've actually, in my office, I've actually had cars out here. We've turned it on at night and simulated what it looks like to look at headlights. And the system actually has a headlight simulation program that we've actually worked with. It has a wide field of view over 20 degrees. It is programmable, and I'll show you the tablet that we use to do that in just a few minutes. It allows for simultaneous vision, so one can actually simulate a multifocal. You can actually simulate an extended depth of focus lens in one eye and a trifocal multifocal IOL in the other eye, so patients can actually compare in real time what it would look like with the different options. You can also simulate monovision as well. So this is actually what it looks like in the exam lane. Here you can simulate with distance images. This is under photopic light conditions, and you can also do a near test and demonstrate that to the patient. In addition, you can document their visual performance, and Dr. Susanna Marcos and her group have developed a scaling system so that you can actually document how successful they are with distance and near vision, what their level of satisfaction is with each different type of multifocal. So with this, you can demonstrate a monofocal lens, an EDOF lens, a trifocal. You can do mix and match, as I mentioned before. The SimVis patient gives patients preoperatively what they would experience postoperatively if they decided to try multifocality. So this is taken from some work that Dr. Marcos's group has done, taking clear lens extraction patients, and with these patients, they actually do the SimVis simulation and do a defocus curve, as you can see in the lower green scale on your left, and then compare that to the patient after they get a fine vision trifocal in a group of 12 patients. And what you see is they actually perform a little bit better, as shown here on the dark dotted dashed line group. They actually perform slightly better with the fine vision trifocal. In another study they did on cataract patients, again, the patients did the SimVis simulation and did a defocus curve, as you can see here. And then after they had their cataract procedure with the fine vision trifocal, this was their defocus curve with the actual intraocular lens. And you can see there's a really excellent correlation between the two defocus curves. But what I really like about this is that the patients actually did a little better with the fine vision trifocal than they did with the SimVis. And from me as a clinician, I think that that's reassuring in the sense that you're under promising and over delivering. The intraocular lens itself actually does a little bit better than the SimVis. And part of this is probably because the patients have some cataract. And I'll show you in just a minute that you can do this in patients with mild and moderate cataract. But if you have a patient with a severe cataract, obviously this is not going to allow them to get good simulation. So I'll talk to you in just a few minutes about that. So we can use different lens implants, the panoptic, the symphony pattern, the fine vision trifocals. And this just compares the SimVis measured in a group of patients that were presbyopic, developing a defocus curve, and comparing that to the defocus curves that were published in the literature for each of these, the panoptic, symphony, and fine vision trifocal. So this allows us to actually do a performance evaluation using what Dr. Marcos and her group call the Multifocal Acceptance Score, or MIS. This is done, they can do this with simulating contact lenses and then see how they do with that. And they can also do it with intraocular lenses. I like the way that they've set this up in terms of the upper left corner set of images are basically the photopic images that one sees on the screen about a few meters away in the exam lane. And the nice thing about this is that it uses all different spatial frequencies. There's an image of a face, which is basically multiple spatial frequencies, high spatial frequency, low spatial frequency. And similarly, they use a high spatial frequency carnival party image, and an image from San Francisco streets showing a streetcar. And this shows you what you see with all different levels of contrast sensitivity and spatial frequency. So in addition, they also use a dash light, as you can see on the middle left figure, and then a nighttime map that often some will see in a car when you're driving. So they actually can simulate that under low light conditions. This lower screen basically shows a stereo vision test that they do in addition to that. And by doing that, you can actually create a matrix. Dr. Marcos's group creates a polygon. This is if you treat the far vision with a monofocal lens in both eyes, and this is the pattern that you get. Now, if you compare that to a bifocal, multifocal IOL in both eyes, you notice that the near vision actually gets a little bit better, and you can compare that to a monovision, monovision lens where the near vision does get better, but the stereopsis actually is reduced. And you compare that to a modified monovision shown in the gold, where the stereoptics is improved as a result of the modified monovision. And you can actually measure visual performance using this with this SimVis system. Okay, so this is the very last slide basically. And the big question is, well, can you do it in patients with cataract? This is a study basically that showed you can do it in 9 pseudophakic patients. The scatter index varied between 1.1 and 11.75. The IOLs are similar pre and post, and the correlation is very high. So in summary, it's non-invasive, and it allows us to get a personalized approach with presbyopic modalities. Thanks.